Hey guys, I probably don't even need to introduce my guest today, but just in case, Mr. David Contorno, for those two people who have been under a rock the last couple of years, give me an introduction on you, your organization, and guys like you have to have some extra fuel in the tank. What fuels you? What gets you out of bed? What's your why?
Well, so I have been a broker since I was 17 years old. I'm now 44, so I'll let you guys do the math on that. But for the first, 17 or 18 years of that, I was a traditional broker, which I define as someone who's bringing the products and services of other vendors to an employer, being paid by those vendors, and really is just a conduit of information. And that's really what I was for almost 2 decades. I'd shop the market, put the best offers in front of the client. And it was a pretty sweet gig though, because every year I got a 10 to 15% pay raise as my clients' rates went up. I had no accounts receivable. For anyone watching this that has to collect money from their clients, accounts receivable is no fun. And when we talk about direct contracting, you'll understand that we play with that in the direct contracting. I had no depreciating assets, and there was no way that an employer was going to not pay their electricity before they don't pay their health insurance bill. So I had protection even in a bad economy. But the problem was, and this is where my why started to come about, was here I was driving up to this client in a 6-figure automobile, wearing a 4-figure suit, talking with people, all of whom came in a 6-figure automobile and a 4-figure suit around a $25,000 conference room table. And we're making decisions that ultimately are now putting these $5,000 and $6,000 and $7,000 out of pockets on people, way down there who make $15 an hour. And what got really hard was not that meeting. What got really hard for me was the meeting a few weeks later when I was now telling the employees how their plan was changing. And almost without fail, it was changing for costs going up, benefits going down. And that's what got really hard. And I started to see statistics like the number one cause of bankruptcy in the US is medical bills. Okay. Not that surprising, but you know what is surprising? 2/3 of those people had health insurance. And I don't know about you, but when I first took my insurance license in New York many years ago, they told you about the history of insurance. And the insurance has been designed, and to this day, everywhere except healthcare is still the same, to do one thing and one thing only: protect us from catastrophic financial loss. And yet health insurance is the one insurance that many people go bankrupt when they actually use it. So that's where my why came about and what sort of shifted my path.
And, it's what we became brothers from another mother on. I mean, I think you know this, but 67% of all people file bankruptcy because of medical reasons. I am one of those people. My family, because of one drug, Revlimid, I am somebody who lived a household of a bankruptcy with 2 working parents that both had medical insurance for their jobs, but who the hell has $10,000 every single year of out of pocket just saved up in the bank while you're trying to send your kids to baseball camp and put Air Jordans on their feet. So I completely relate to it and I love it, which gets us into the topic du jour, which is the reality of, we talk about guys like you that are on stage, preaching. We talk about the healthcare system being broken. And I love the way you point this out, that it's not necessarily broken. It's designed exactly the way it was designed. It's just designed for, walk us through that fundamental difference on what should be the case versus what is the case.
Well, so yeah, it's exactly, I say, listen, the healthcare system is not broken. It's working exactly as it was designed. It just wasn't designed by employers who foot the bill, doctors who provide the care, or patients who receive the care. It's not working well for those 3 entities. And arguably, those are the 3 entities that it should be working the most for. And what do I mean by that? Well, first of all, the average broker is paid commission. That means as your costs go up, how much money the broker makes goes up. And I'm not here saying that every broker out there is intentionally making the costs go up, but I'm saying they have no incentive to make the costs go down. None, zero. So there's one perverse incentive. Now let's talk about how insurance companies make money. I mean, I ask CFOs all the time, if an insurance company keeps claims down, if they come in at half of the expected claims in a year, does the insurance company's profit go up or go down? And every CFO says it goes up, of course. And you and I know that's not the case because of the medical loss ratio provision of the Affordable Care Act. It says that they must have an 80 or 85% spend on healthcare. So they get to keep 15%, and 15% of a bigger number is a bigger number. So the insurance company makes more money as costs go up. For those of you that deal with self-funded plans, you know that every plan has a pharmacy benefit manager. They make more money as more drugs and more expensive drugs are filled. The health systems that are actually being reimbursed this money, they make more money as reimbursements and costs go up. So you want to know why costs keep going up? Because everyone that an employer trusts to manage their healthcare costs, the broker, the insurance company, the health system itself, all benefit from costs going up. And you know one way for costs to go up is for quality to go down. The average complication for a patient that is inpatient at a hospital nets the hospital an additional $10,000 of profit on average. So the whole system is built on a high volume of claims and a high severity of claims. That is what maximizes profit in the system. And if you don't think the healthcare system is profitable, I encourage you to look at the financials of all the nonprofit health systems and health insurance carriers, or the public financials of those publicly traded companies. And you'll see not only have they been doing really well, but this pandemic has been very good to them financially as well.
So over the years, the reality of it is the risk mitigation, the cost mitigation. How do I keep the escalating cost of healthcare? The only strategy that most employers have done is increase deductibles and out of pockets, which has turned hospitals into collection agencies. And the reality of it is you see companies like Walmart and GM and people like that having relationships directly with the employer. But most people who would be listening to this right now don't think that they could do it, don't understand what it, and I want you to hit a snippet because you are one of our speakers in June, and I don't want to give away the farm, but give me the 30-second pitch on why this thing called direct contracting, which it doesn't make sense for somebody that says, wait a second, I can get a better deal than insert insurance carrier here can get with that hospital. Walk us through that.
Well, and I've been asked directly, David, you think you can negotiate a better contract than United Healthcare? And my answer is no, I don't think I can. United could negotiate a much better contract than me. They're just not motivated to. Their incentives are the exact opposite. So I ask an employer, would you rather have someone really good working against you or someone mediocre working for you? You know, but the real problem in our healthcare system is in the network contracts. It all boils down to this contract that you and I can't see. We're told is proprietary and confidential, but it sets all the provisions of payment. It says what the discount is. It says whether audits are allowed, and if so, how. It says how fast they have to be paid. And it's driving the cost of every health plan, and yet you can't see it. And I forget the exact amount of money, but there was an article that came out a couple of years ago about, and ironically, it was GM made a direct contract with Henry Ford Medical Center, ironically, but they saved something like $7 million, not changing a single thing. The same patients getting the same care at the same facility, just by cutting out those perverse incentives that also come with all these extra layers of cost as well. So, you know, and a lot of employers think, well, if I'm a bigger employer, I'm going to get better pricing. And that's not true either, because I use the example here in my town where I live. Lowe's Home Improvement is headquartered here. So there's this huge campus in this little town in North Carolina, and they're self-funded and they have Aetna as their network. And so imagine if a Lowe's employee goes to get surgery at a hospital, and Joe the plumber, who has 10 employees, fully insured Aetna plan, one of his employees goes to get the same procedure by the same provider, coded the same way. What's the price? It's the same for both of them, right? Even though Lowe's has 250,000 employees, they just paid the exact same price for that care as Joe the plumber's plan, who has 10 employees, because it all flowed through the same PPO contract. So, you know, if you want to, this is my stroke of genius for the day. If you want to pay less for healthcare, you have to pay less for healthcare. Shifting deductibles, going fully insured to self-insured, none of that really substantially does anything, except when you pay less for healthcare. So, and I want everyone to know, I went to college for photography, and even that I didn't graduate at. So I am no financial wizard by any means, but I literally learned everything I need to learn to fix healthcare by 9th grade economics. If you just apply normal financial principles to healthcare, if you look in the right places and apply those principles, it's easy to save 30, 40, 50%. I know those numbers might sound fantastical to some, but that's how much bloat is in the system. And I guarantee you, if there was a real efficiency expert and a real financial genius who put their eyes on healthcare the way I have, they'd probably find even more.